Dr. Mane, do you think the image has to be restored more by the big hospitals or individual doctors? Because the present feeling, Dr. Neelam Mohan has spoken about it, but the general feeling of the people is that when you go to a big place, they try to extract money out of you. There have been a lot of stories, they may be all false, but this is what we hear, that when you take a patient to a big hospital, big chain, they keep the patient there for unnecessary, for longer period than it is necessary. How far it is true?
Dr. Malik is not only past president of Indian Medical Association, he also is the chairman of a group of hospitals. He is the right person to answer.
Okay, the right person to answer.
Running a hospital himself in Palwal, and his vision is that he wants to open up at least 100 hospitals in the next 10 years in smaller cities. So probably he will be the right person to answer this question.
I didn't know that, but that's the right person to answer.
Thanks, KK. I think I have very different views and very strong views, and I'm those of you who know me know that I'm very straightforward and blunt. I'll pick up from two words which Neelam left: nobility and money. You know, the general perception in India is that if you are noble, you're supposed to be poor. You're supposed to be charitable. You're supposed to be doing free work. I'll give you practical lot of examples, simple ones, which will clarify the issue, because I think the issue is extremely important. I had a class fellow, we did MBBS together, and he immediately went to the US after that. Dr. Naresh Jain is a very eminent gastroenterologist of the US now. When he came back after 2 years, the first question I asked him, I said, Naresh, what do you think is the difference between the working there and the working here? And of the many things he said, one thing which he said was that if you make $1 million in the US, you were treated and looked upon as a genius. If you make $1 million in India, you're looked upon as a black marketeer, someone who's swindling money. So but it's a very pertinent issue. It's a very pertinent issue. Two, you know, there's one aspect which I'll touch very little upon, and that's the ability and capability of doctors in India. Someone talked about the Harley Street Polyclinic, and I've been there and I've seen how at midnight, if you want to get some feedback on your 2-day-old child who's been just operated, all you can go is to a kiosk and ask some questions, and there's no one to answer it. The capability, the intelligence of Indian doctors, and I don't say it because I happen to be one, I think is amongst the best in the world. There's no debate about it. But at the same point of time, we're living in a society where there is a general degradation of moral values. I remember about 25 years back, I bounced into one Dr. Colonel Chopra, KK's boss. He's the person who was one of the founder trustees of Moolchand Hospital. And I asked him a simple question. I said, sir, and that's my personal belief and strong conviction, and that's why I start from there. I said, sir, you charging 150 rupees as consultation. You're supposedly one of the most expensive. He was one of the first persons in private sector cardiology in the city. And I said, don't you think it's very less? So he looked at me, he said, a lot of people think it's very high. I said, at that point of time, and if you were to take it with today, with no offense meant to some of my friends from the legal profession, I have good friends in the legal profession who charge you per hour and runs into a few 100,000 rupees for a consultation or a meeting, or a few lakh rupees for an appearance in a court, which the date gets adjourned. And name one doctor in India who charges 10,000 rupees as consultation fee. If you pick up the list in US of the top 100 rich people, there are 32 doctors. And you pick up the list in India of the top 1,000 rich people, there are only 3 doctors. So the issue is, we are being hypocrites as the profession, and I accept it. We're being hypocrites. At one point of time, we talk about, we are noble, we do so much. When KK told me, I asked him yesterday evening, I said, what is the topic for today? He said, nobility of medical profession. So I was quickly just surfing the net while in my car and said, what does nobility, what does the word nobility mean? So it means a state of exaltation of your character, conduct, ideals, or elevation of mind. So it doesn't talk of you being poor. It doesn't talk if you want to wear a branded shirt or a branded shoe. I'll give you another example. When I was the national president of IMA, we started a program in IMA called Aao Gaon Chale. We launched it all over the country. One of the first places we launched it was in Rajasthan, in Jaipur. And the health minister of Rajasthan was the chief guest. And do you know what was his opening statement in his address? He said, "Aao gaon chale." क्या शहर में पैसा खत्म हो गया कि डॉक्टर गांव की तरफ आना चाह रहे हैं? Now that's the perception. That's the perception that we are the poorest of people, but because we carry a white-collar doctor image, so I can't afford to be traveling in a stupid car. I need to maintain a particular life standard. But the fact is, doctors need to elevate their level of earning honestly and ethically, because unless they do that, they will keep doing manipulations. When KK told me we're going to talk this, I said, I am a staunch supporter of Amir Khan. I don't know him, for heavens, but on issues which he raised. Because the fact is that there is a genuine moral degradation of values. The fact is that every top corporate hospital in the country pays you commission by check. The fact is that you cannot run a diagnostic center if you don't pay kickbacks. But that does not mean that the fact is that doctors do something. There may be a very minuscule number of people who will do a referral, who will probably do a surgery, unwanted. I don't think that's correct at all. I'll give you another example. I bounced 3 years back into a man called C.K. Prahlad. I don't know how many of you know him. And I was in the US and I was talking to him. I was a member of the Planning Commission Steering Committee of Health for the last 2 5-year plans. So I was giving a model every plan to the government that, see, this is how we believe we can solve India's healthcare problem in rural India. And obviously, typical as government style, it will always go to the pin. So I bounced into this wonderful man called C.K. Prahlad, and I was sharing my frustration with him. I said, see, the damn thing doesn't happen. You know, we always talk of doctors don't go to rural areas, doctors don't go to small towns. And C.K. came up and said, and that was the first time I came to know that he was the author of that famous book called Making Your Millions at the Bottom of the Pyramid. He said, work out a business model. Work out a model in which you go and do a good job. Work out a model in which you go and give good services and you can still earn money. Because earning money, there's nothing wrong in it. If I do something very ethical, if I do something very nice, and that's what I'm doing presently. You know, we're opening up a chain of hospitals in tier 3 cities, in the rural outskirts of tier 3 cities, and giving them world-class services, strongly and ethically. I had a man who was going to supply me the hospital information management software, and one of the modules I didn't take, and he was surprised. So there was the module of the 17 modules which are there in an HIMS. There was a module which says doctor monitoring of their referrals, interdepartmental and diagnostic referrals. I said, I don't need this because he says, what the hell? Every corporate hospital insists that you need to have a model where you should be able to monitor how much of referral goes from your in-house doctors to your diagnostic center, to your cross referrals. So let's understand that is the truth today. If you look at what corporate sector top hospitals have done, amazing work. Amazing. 25 years back, when my father had a cardiac problem, we needed to take him to Denton Cooley in Texas, Houston. Today we're looking at the reverse. We're talking of medical tourism. We're talking of people from US and UK coming to India for treatment. Indian healthcare delivery is one of the cheapest economically in the world. So why are we ashamed of the fact that we are very economical? Why are we ashamed of the fact that nowhere in the world can you get a normal delivery done for 5,000 rupees? Why are we ashamed of the fact that you have a lovely scheme called RSBY, the BPL card scheme, where people pay 300 rupees and get an insurance? And if you look at the rates of those schemes, I don't think your AC mechanic who will come to test your air conditioner in the house charges you less than what the RSBY scheme pays you for a cesarean section. But the fact is that not many people talk about this. Why can't people get up? You know, we had a meeting in our district the other day called by the DC, and people were complaining that the RSBY is not paying. So a lot of people had their bills pending because they had investigations going on and all of them were manipulating. So I got up and said, why can't we go back to the government? And I told that to the Prime Minister personally when I met him. I said, you need to change this, because if you're going to give me 500 rupees a day for patient care, which includes everything, right from his CT scans to MRIs to medications to ICU care, I'm going to manipulate. Well, there's no other way I can give treatment because it costs me more. We talk of prices of medicines. I think Amir talked about prices of medicine, which a lot of people got worried about. He talked about pharma companies paying kickbacks. Is it not a fact? Is it not a fact that pharma companies give you gifts, air tickets, hotel bookings, conference tickets, all because you prescribe their drugs? But are doctors to blame? You look at the DPCO, you look at the government policy, the same company manufactures the same molecule under a branded name and under a generic name, and the price difference is on an average 17 times. Someone needs to go, someone sitting in the corridors of Nirman Bhavan decides that you will allow a particular company to manufacture the same molecule in the same factory as a branded and as a generic. One costing 26 rupees and the other 1 rupee 30 paisa. And then you say that there is an inequality. Now, what is this company going to do? The fact is, even on the capsule which they sell for 1 rupee 30 paisa, they make profits. But the doctors do not prescribe that. I am saying, why are you allowing that company to do something like this? So there is a fault in the system. And every time something goes bad, something goes faulty, you put up the doctors get blamed. We are all living in a society where all of us want to be comfortable, if may not be stupendously rich. All of us want to be living the same lifestyle with people of our educational or social qualifications do. And unless we change that structure, and unless the profession honestly and boldly gets up and says, please change this, then you would, to maintain that status, you will keep looking at kickbacks, cutbacks, commissions, and probably some unethical work. So I think it's a time even for the profession to take a very bold stand on what needs to be done to correct what is going wrong with the medical profession itself. I remember KK also does the same. We used to do some medical conferences when I was into healthcare publishing, and we were covering certain national conferences because we used to bring out daily newspapers there or things like that. And so you call up that city, call up all the hotels in the city for your own booking, and you don't get a room because the whole city is blocked by pharma companies. It is the truth. Let's accept it. Now, if you're going to be picked up from your house in a limousine to the airport, from the airport to the hotel, all paid by a pharma company, you would probably have to oblige them. Elevate your own standards. Bring them up because you're ethical, because you're good doctors, because you're one of the finest doctors in the world, but you don't have the guts to say, let me elevate my standards. That's my very strong, maybe very different view from a lot of other of my colleagues. Thank you very much.
Thank you very much, Dr. Malik. What I conclude from you is that there is a need to do some rethinking and improve the image of the profession. I suppose that is the need, as Pramod said, in all professions. I have been with as an active journalist for 35 years, and I find that we also need a lot of things to correct ourselves. It's in every profession, whether it is politics or it is medical or journalism or anything. So the thing is that one thing I would like to point out, with my apologies to you, that nobility is something which is required in all professions. It's not only doctors. And secondly, that if a doctor comes in a car which he owns, and say Buick or a Cadillac or something like that, we feel very proud that my doctor has this. We don't feel that if a doctor comes in a taxi or in my car, that he's not a good doctor. He's a good doctor if he comes in his own car, and it's a good car which he's. So I suppose.
I strongly believe everyone believes that in India, but that's not the situation.
No, I suppose they do.